This is Dr. Sarkissian. In this video, I want to talk about an emerging trend in metal-free implants. Zirconia implants by Z Systems are made of a ceramic material that has proven itself to be extremely biocompatible and fracture resistant. Today, I will demonstrate the case of one lady who had a loose crown over a tooth that had rotted away undetected. The tooth was surgically extracted, a bone graft was placed, and after 5 months of healing, we're all ready to place the implant. After marking the spot through a surgical guide, I used the water lace to create an opening in the gums wide enough to accommodate the implant. After going into the bone halfway down, utilizing a zirconia drill bit, we took an X-ray with a zirconia pin in place to make sure we are in the right position and depth. The implant, in this case a one-piece system, is now inserted. All we have to do is wait 3 months. The patient in the meantime has to wear a protective appliance to protect the implant while it's integrating. The implant is all ready to restore. We treat it just like a tooth stub. We shape it, take an impression, and order the crown. In a few weeks, the crown, which is also made of a completely metal-free material, in this case zirconia, is cemented, and voila, the patient can go home happily with a full set of teeth. I've got a chisel sapphire tip on this, and we're going to make a mark on the mucus ridge. Okay, so now we're going to remove the stent, see if we made a mark. Okay, there's a little mark there, so we're going to create a circumference of about 3 millimeters around that mark. So we're going to have an opening of about 5 to 6 millimeters diameter. And I want you to measure exact depth. Alright, now we have to take an X-ray. The actual implant, we're ready to insert it. We have the size to a size below the diameter. This is a 5 millimeter. So we're going to start to insert it now. Alright, so the implant is fully in. Okay, let's take a picture and an X-ray.
Physicians and dentists agree. Improve your oral health, and you will improve your overall health and well-being. When left untreated, dental disease can cause other health-related problems, potentially increasing the risk of heart attacks, strokes, respiratory disease, and diabetes. For those in need of tooth replacement, dental implants remain the state-of-the-art solution, giving the aesthetics, function, and feel of natural teeth. Over the past decade, zirconia has become the material of choice for tooth and implant crowns. Now, zirconia implants are becoming an increasingly popular aesthetic and healthy tooth replacement solution. Dr. Ted Fields, a Dallas-based oral surgeon, explains.
We used to, in dentistry, think that the mouth was more of a separate entity, and research is increasingly making it clear that that's not the case. One of the big advantages of zirconia as an implant material is plaque adhesion, and bacterial adhesion is less than many other materials that we use in dentistry, and this allows a healthy soft tissue response, minimizes inflammation, and gives us long-term healthy aesthetic soft tissue. They look really nice and they support long-term oral health. It's the first material that I've seen in oral surgery where we actually have patients requesting a specific material.
Zirconium oxide is derived from metal zirconium, but it has lost all the metal properties due to the chemical reaction. Metals are characterized by certain characteristics and properties like electrothermal conductivity and free electrons, but the ceramic material, as a consequence of the chemical reaction, does show a completely new set of characteristics. It does not show any of the characteristics of the original materials. Not all zirconia materials are the same. Their characteristics and strengths very much depend on the way they are processed. Literature and clinicians report that they see less plaque and healthier soft tissue around zirconia implants. This is most likely related to the low surface free energy of this material. Another effect is the hydrophilicity or wettability of this surface.
Zirconia has been used in orthopedics for the past several decades, and Z Systems pioneered the use of this material in dentistry. Swiss Precision, FDA approved since 2007, and complying with rigid safety standards, Z Systems creates an outcome that's hard to match. To learn more about Z Systems zirconia implants, go to zsystemsusa.com/in America.